Hi, my name's DenaLeggiero, and my case study is over moral conflict in clinical trials. In this case study, a doctor is doing a phase 1 clinical trial over a new chemotherapeutic drug for cancer patients. His subject is a Miss Hernandez, a 49-year-old female who suffers from metastatic breast cancer with mets to her liver, lung, and axilla underarm area. Her liver lesion threatens her liver function, which makes her very ill, and despite undergoing numerous clinical treatments, nothing has slowed down the growth of the liver lesion. After speaking with her primary care physician, she has enrolled into the clinical trial. Subjects that are in this clinical trial receive the chemotherapeutic agent via an IV infusion for up to 6 21-day cycles, which is a standard treatment. The purpose of the trial is to collect data on cumulative toxicity that might be irreversible, such as loss of sensation in the hands or feet. The reason this is important is because chemotherapy would have little clinical value if treatment was limited by irreversible effects to half of the cycle times. So the need to test for these effects is required before it is allowed as a treatment. To date, Ms. Hernandez has received 4 cycles, leaving 2 cycles left to go. She does not appear to be sick or fatigued, and has had no irreversible impairments at this time. Her liver and lung lesions are stable, with her liver lesion being stable for 12 weeks, which is the first it has been this way. Her axillary lesion has grown by 22%, which might suggest an increased likelihood of growth at the other 2 sites in the future. There's nothing that suggests that the trial participation is causing the increase in tumor growth in the axillary area, but the continued participation through 1 to 2 more cycles does put her at risk for tumor growth in her liver, which will cause her liver enzymes to increase, which can cause toxicity from the chemotherapeutic agents, which undercuts the prospect of direct benefit from continuing exposure to such risk. The doctor has a scientific duty to collect critical data that her continuing the treatments will provide, due to the fact that all other subjects had to drop out of the trial. The reason for this being that their cancer was so advanced that after 1 to 3 cycles, their health declined so rapidly that they were unable to continue, leaving her as the only participant left. She is the first to provide data on the drug's potential for cumulative toxicity. If she remains free from effects for 1 to 2 more cycles, it will be effective evidence that using the drug on the standard treatment regime does not result in cumulative toxicity. Without this evidence, the next stage of drug development cannot be pursued. Absence of such data could slow down, if not stop, the development of a promising drug completely. She's been made aware of the changes in her lesions, and she's going to go discuss it with her primary care physician. The doctor has the burden of deciding whether to allow her to continue the trial or recommend that she withdraw from the trial completely. Morally, the doctor is conflicted by his oath to his trial and to do no harm to his patient. He knows that Ms. Hernandez has already exhausted all treatment allotted to her in order to fight this cancer, and that in a way his clinical trial is her last chance. He knows that if her liver lesion starts to grow, that the toxic effects of her liver function declining, coupled with the toxicity of the chemotherapy, will make his patient very ill, making her final days miserable, and that she will not have the quality of life that one would want or that he would promise her. He also knows that if the rate of the lesion growth is increasing, that her life expectancy is decreased, giving her less time with her family and friends, all for the sake of his trial. If the doctor was a utilitarian, he would have to take a step back and look at the whole situation on the side of what would make most people happy in this situation. Not that you can have a real happy situation in dealing with cancer. This chemotherapeutic agent that he is working on could possibly save many lives if it can get out of the beginning stages of testing, which would require his patient to finish the last 2 treatments. She's not sick, 2 of her 3 lesions are stable, and if she can be watched closely, then he can get the last bit of information he needs. If he were to monitor the situation close enough and get those last 2 treatments in, and there was no great change in the other 2 lesions, then the trial would be a success. She would be no worse for wear, and everyone would be happy. But if he would stop the trial right now, out of fear, everyone would suffer. His work would be in vain, and no one would be happy. So that's not the option he would choose if he was a utilitarian. Now, if he was to follow Kant's line of thinking, the doctor would use his patient as an end and not as a means. In this case, the end is her health, whereas the means is his research. Her health is at risk by the increase of one of the lesions. So if there were any other options to offer his patient, he would offer that before continuing on with his research. But in this case, she's already exhausted all of her other options, and his research is all that's left to her, unless there's any other clinical trials that she could possibly do. In this case, he would have to continue on with his trial, after only considering all of his other options. Under social contract, it is implied that there is an unwritten law that you do unto others what you would want done to you, and that you do what is right, of course. The doctor would look at all the facts. The patient has metastatic breast cancer with mets to 3 areas. She's failed conventional treatments, with this trial being her only option left. There could be other trials out there that might be beneficial for the patient, but she would have to be off of all other chemotherapeutic agents for so many weeks before she could start any new treatments, which would leave her exposed, and the stop growth in her liver enzyme would start to grow again without therapeutic agents in her system. And the trial that she is currently on did stop the growth in her liver site, which is where she was having the worst effects from, because it was causing a decline in her liver function, which was making her sick. After considering all of this and talking things over with the patient, then the doctor would decide mutually with his patient what would be in her best interest for them to do. In conclusion, a clinical trial is usually a last-ditch effort at saving someone's life. In the case of cancer, and with her having no other real options, I would feel like as long as the 2 main lesions are not growing and she is not having any side effects, it would be safe to continue as long as she's being watched carefully. But that there are only 2 treatments left is the only reason why. If she had more than 2 treatments left to go, then we would need to stop and look at other options. They would need to scan her frequently and watch those 3 lesions to make sure the one in her axil is not getting worse, and to make sure the other 2 haven't started growing. If the other lesions start to grow, then it would be time to stop the treatment. If she had any other options left, then it would be in her best interest to go forward with them. But in most cases, these clinical trials are their last option. Thank you.